What's going on, YouTubers? Back again with another one of these videos where I answer your questions. Got a lot of questions since the last video. Won't be able to answer all of them today, but I'll definitely try to get through as much as I can. With that being said, let's go ahead and get this video started. Alright, so for the first question today, I have a question from Ariba. He says, I came to your channel searching for whether or not I should do MD. I recently came to this idea of doing MD after PharmD. I graduated with PharmD in 2012, basically 2013 when I got my degree. Shout out to you because I graduated in 2013 as well. I still have to clear OSCY. Not sure what OSCY is. Don't attempt though if I think of MD after I clear my OSCY. How many years I have to do after 4 years of study? I'm asking about residency and fellowship. Please guide. Also, I'm 29 years old. Honestly speaking, is it worth it now? That's the million-dollar question. I'm excited but confused as well. I also love trauma surgery. Please help me clear my mind. So, Ariba, to answer your first question, how many years of residency and fellowship do you have to complete after medical school? So, I'll give you 3 comments here. The first comment is that there's a great resource from UW that kind of outlines how long it takes to do your various specialties or residency and your various subspecialties or fellowships. They kind of link the lengths of time for each one of those. But you specifically say you're interested in trauma surgery. What I found, and to my understanding, after medical school, so your 4 years of medical school, you have to do 5 years of general surgery residency, which kind of gives your basics, foundational knowledge of surgery, and this is followed by 1 to 2 years of trauma surgery fellowship. The last comment I'll say about this is something else I considered was infectious disease, and for that you would need 4 years of medical school, 3 years of internal medicine residency, followed by 2 to 3 years of an infectious disease fellowship. All in all, if you want to do trauma surgery, that's about 10 to 11 years. And if you want to do infectious disease, that's about 9 to 10 years. And I never really thought about it until now, but that's actually not a big difference between the two. I've always thought like surgery that's a lot of years. Right, so your other question is it still worth it at 29? My thoughts here has always been, if you love it, it's worth it. With that being said though, there's a lot of comments I'll make about this, and hopefully it'll help you out. The first comment is kind of a story where I remember telling my mom this. I was about to graduate pharmacy school, and I was on the phone with her, and I was just like, hey, I'm thinking about going to medical school after pharmacy school. And I know she did not explicitly say it, but I could feel it. And she was just like, you are a crazy, crazy person. She probably thought like, is this really my son? Because that's crazy. You just went to pharmacy school, you're about to graduate, now you're about to throw yourself back into medical school loans and all this kind of stuff. So yeah, I think she was thought, so that's one thing. It's a big decision, what is kind of what I'm trying to point out, right? It's a huge decision. It's a big decision. But honestly, I think to answer your question, it really depends, and it really depends on you. When I thought about this, I really thought hard about what I wanted in life. And for me, when I was thinking, I really felt as though I was placed on this earth because I truly want to help others. And I think that my purpose in life is to help others. During rotations, I had discovered that I loved the art of medicine, and I really wanted to help patients by giving them an appropriate and correct diagnosis so they can get treated. Now, if you're 29, give or take 1 more year for like applications and just downtime, so 30. 4 years of medical school, you'll be 34. 5 years of general surgery residency, and you'll be 39, and then followed by 1 to 2 more years of trauma surgery fellowship, and you'll be 40 or 41. If you retire at 65 and you're practicing at that time, that's 24 solid years of practice. And I looked at that too, and I was like, is it worth it? You're 29, but you still have 24 years to do what you love. And that's kind of how I looked at it. And for me, I felt as though that was worth it. Now, I'll add 2 more comments that kind of contrast with each other to hopefully it'll probably just make you think. It's not really an answer. So the first comment is, I remember I was doing my ED rotation at Tampa General Hospital. I remember responding to a trauma alert one time, and I ran there, and I was one of the first ones to get there along with another doctor, and we had both started to gown up. The patient hadn't arrived to the hospital yet, and I was able to exchange a few words with him. So I didn't ask him specifically for his age, but it looked as though he was in his late 40s or early 50s. And crazy enough, he was in his first year of residency. So he just graduated medical school and he was just starting his first year of residency. The thing was, and I didn't get to talk to him too much afterwards because the patient had arrived, but the thing was, he seemed like he loved medicine. Like he truly loved it, and he was very passionate about it. And what I want to try to say with this comment is that, you know, life is not always point A to point B. It's like a zigzag, you know? And it's okay to find your passions later in life. So for him, it was later, but you know, he loves his job. Now the second comment, which is completely 180 of this one, is truly, if you want to pursue this route, especially if you want to pursue trauma surgery, really consider hard and think hard about the sacrifices you are willing to make. Now, unless you're very well off, pursuing medical school after pharmacy school is very expensive. And I kind of talked about it in the last video, but the estimate that I came up with along with Dr. Nicholson when I was chatting with him about it is about $1 million. You know, pharmacy loans, medical loans, then you have the interest on those loans, and man, let me tell you, after I graduated and I started paying that interest, that hurts. It really hurts. So that's one thing, right? And then also the income lost while you're going to medical school. Now to add to that, there were a couple of friends of mine that did go to medical school after pharmacy school, and what they did to supplement that was to actually work part-time as a pharmacist while going through medical school. Obviously, medical school is pretty hard already, so to add part-time job to it, that's even more intense. So but something to consider though, right? The thing that's bigger than money here though, and I think is the bigger sacrifice, is family, friends, and loved ones. During my time on rotations, I met a lot of brilliant trauma surgeons, and you know what was very disheartening to hear and see was that many of them were single and not married. With that being said, I want to give that disclaimer. This is obviously very anecdotal in that not just because you want to pursue trauma surgery doesn't mean you're not going to get married. This is just what I saw, and it was just something that really made me think too. And when I spoke with them, they were like, you know, trauma surgery, I don't have time for anyone else. They basically said that they were married to their jobs. So trauma surgery is certainly very demanding. You can certainly have a family. I only spoke to about 2 or 3 trauma surgeons that was in that situation. I'm sure there are many others that are married, but it's just something to consider, because the time you spend in the field and away from family and loved ones can be pretty taxing. So something to consider. Definitely not an easy decision. I don't know if that helped or not, but I really think that what it comes down to is you kind of thinking, what is it that you want out of life, and what are those sacrifices you want to make? All right, so I hope that helps. Next question is from Zafir. Actually, it's not a question, more so a comment. Zafir says, "Hello, Brian. Thank you so much for sharing your experience between battling med school urges and pharmacy practice. I could so relate to your thoughts while rounding in hospitals and wondering whether I should pursue med. I'm currently an M2, graduated PharmD in 2014, and I've worked inpatient, outpatient, retail, and everything in between, and finally decided to take the plunge in 2016. That's crazy. That was like last year. I have absolutely no regrets today. I think what pushed me into a medical career was I was so fed up with the limited scope of practice that pharmacists have. As a pharmacist, we learn so much in pharmacy school and apply so little. I was tired of feeling so inadequate. Secondly, I also couldn't live without knowing what would my life have been if I hadn't tried one last time. Got rejected 2 times prior to pharm school. Anyways, I think your video would really help out those outliers in pharm school who are considering a switch to medicine. Also, if any of your viewers need any advice on the switching process, I'd be happy to help." So, Zafir, I really appreciate your comment. And actually, part of the reason why I did the video in the first place was in hopes of getting comments such as yours. because I think this is such a big question. It'll be great discussion, and for others, especially nowadays, millennials are always on YouTube. This is, I feel as though, the source of information for a lot of those individuals. And I also completely agree with you in that we learn so much in pharmacy school, yet we apply so little of it in our day-to-day practice. Definitely big props to you. It's amazing that you continue to persevere and apply despite getting rejected twice. For those of you who are watching, it does sound like Zafir is willing to help those who are currently thinking of or in the process of switching. So definitely hit him up. And Zafir, if you're watching this video, definitely have to follow up with you in 2 years after you finish your med school training and get some updates. Alright guys, so that was kind of a short video for today. Looking to answer more of your questions next time. And until next time, guys. Hey guys, thanks for tuning in and watching the video. If you like the content, definitely hit the ImproRx button over to your left to subscribe, and definitely check out more videos over here to your right. Now, as always, if you have questions, comments, and even better, suggestions for future videos, definitely let me know in the comments below. Otherwise, until next time, guys.